Welcome, everyone. This is Coffee with the Founder, where we explore what it takes to do a venture backed startup and why are people doing this to begin with, because you're kind of crazy to do it. Jeff knows this because he has something called founderitis, which is you keep coming back to do the startup thing again. We'll talk about that. With us today is Jeff Glueck. I got it right. Founder and CEO of Salvo Health, looking at the gut and really helping a lot of women. 84% apparently is what you just told me, Jeff. So welcome. Thank you for being here.
Thanks for having me, Beck.
Yes. Okay, so Jeff, why are you back once again in this crazy thing of startups? As I said, you have what the disease I know so well, founderitis. Keep coming back.
You've described it well. You got to love coffee and you got to love building things that you want to
Yes.
see in the world. And
Yes.
it's for me, Salvo Health is a culmination of a mission and a vow I made long
Yeah.
ago to
Yeah.
make a dent in healthcare and use the 25 years I've been building startups to bring to this new field called health, which is
Mm,
so broken in
yes.
America,
It really is.
and make my contribution.
Mm-hmm. Mm-hmm. Now, before all that, you were CEO and also COO at Foursquare. You were at the CMO of Travelocity, like big, huge companies. You were mentioning a little bit to me on like, when you exit, then you're back in a big company typically, and you're doing that and so forth. So, as you have been on both sides, what's your favorite and why?
Well, I mean, I love founding things because you get to kind of embody your values into
Yeah,
them, and once you grow them up and they're acquired, and I've been through four,
yeah, yeah.
four exits in my life.
Dang.
You lose control of your baby. I mean, the pros we saw at Travelocity when I ran product and then marketing for 7 years after they
Mm,
acquired the startup I co-founded called Site 59.
59. Yeah.
Yeah, and so the beauty is, I said to our team, look, you get to be on a bigger stage now. We were
Yeah.
a $100 million company. Now we get to be part of a $3.5 billion company, and we get more
Mhm.
resources and all that. And so it was a great experience, and I stayed 7 years. But sometimes you just kind of lose the thread, and the new owners don't get it.
Mm,
And so what I really love in founding something is it does represent a
you.
mission.
Yeah.
Yeah.
Yeah. And it represents you. Okay, where I'm missing the thread though a little bit is okay. We were in travel. Okay, Foursquare. We're in the health sector. So how do we loop
How
to
did I
health?
get to health?
Yeah, how do we get here?
I
You
think
were you were an EIR entrepreneur in residence at Matrix Partners, which is where founders go to like rest, invest, and kind of think about things. Their next thing, typically. So how do we
well,
get to the gut?
yeah, I think the journey is very personal for a lot of
Okay.
healthcare founders, and for
Yeah.
me, you have to go back uh, to something my wife and I went through 17
Mhm.
years ago.
Oh,
We
do
were
tell.
we were we were expecting our first kid. We really wanted a child, and we lost what would have been our first son at 23 weeks into a pregnancy.
Oh,
And it was one of these like tours of so many things that are broken. The hospital said to us, "Oh, we
yeah.
don't test for that genetic clotting factor
Mm.
until a woman's had 3 miscarriages,"
Oh, oof, oof. Damn, that's
which doesn't
horrible.
make a lot of sense.
Mm-mm.
And then, but even more profoundly, we were devastated
Yeah,
in the OBGYN's office, and I remember looking for solace and asking, does healthcare learn from this? Like, is the odds that a couple is in these chairs in tears in a month change? Because please tell me all of this data goes into some
yeah,
research database,
yeah,
longitudinal database, and the best academic physicians, researchers, and data scientists are making care better for the next couple, whatever in this case,
right.
prenatal care, or maybe
Let,
it's
let me
GI
guess the
care.
answer.
And the doctor, she
Nope,
just looked at us and said, "Nope, nope, that doesn't work that way.
no,
There's no learning. It's just
we're not
lost.
doing that. Right.
Yeah, that's not how it works." And that was 17 years ago. And at that moment, I remember vowing, I have other things I'm working on right now, but someday I'm going to start a company to work on this and use everything I've learned about how to scale Travelocity to 11 billion in sales, or how to grow Foursquare 10x, and all of these things using data. And we're going to bring that to health, which is the most important thing in people's lives. Without health, you don't really have anything. And so that was the journey. And then other things led us to gut health. Our twins, when they were born, I was running a company out in the Bay Area, and they came back from Stanford Hospital, and they were breaking out in all these hives and rashes all over their tiny bodies, our twins, newborns. And my wife started looking into it, and we realized it was the kind of neurotoxins and skin irritants and things that the hospital had given us, full of these chemicals in the diaper cream and in the breastfeeding pillow and all that. And she started researching with environmental health scientists and doctors in functional medicine and the like. And she ended up creating a nonprofit with the learnings, because there's so much in environmental health that doesn't get incorporated in mainstream. And I was thinking, why isn't this incorporated into mainstream healthcare? And so all those things came together during the pandemic, and I had a moment where I could start a new company, and that became Salvo, which is really, really about what we'd learned in all of our journeys was that gut health, the brain-gut connection, the microbiome, metabolic health, all of these things are the gateway to all kinds of health, not just gut health, but your overall health and your longevity and brain health and cardiovascular health and metabolic health. And that there just isn't the resources to help people through these journeys. And there's 80 million people who suffer from chronic GI conditions.
Weird stuff in the gut. IBS, things like that.
IBS is our most frequent condition. And the reason why 84% of our patients are women is that, in particular, IBS disproportionately affects women. And women face all kinds of gaslighting and stigma, especially younger women in the healthcare system. You know what the doctors, Beck, used to call IBS?
Oh, God. No, what?
For decades, they called it hysterical housewife
syndrome. I was gonna say it was like hysteria, crazy, something.
And of course, now we understand, instead of it's in your head, it's actually in your gut. Like, there's this brain-gut connection, and the gut is where 90% of the serotonin and 50% of the dopamine are created. So it's not in their head. It's a biological process of disorders of brain-gut interaction, and the science has come a long way, and yet these doctors' offices aren't set up with the training in food as medicine and GI psychology and the resources to help these patients. And that's what we do. We come in and we extend the doctor's office to this kind of virtual 21st century experience between visits, and it works.
Wonderful. So needed. And yes, I think all of us have a story or something where you're in the doctor's office and it's just like, oh, it's no big deal. Oh, you're not making, it's nothing. It's something like this. I was getting myself an MRI scan, and twice they almost messed up. They first were going to put me with some IV, and I was like, wait, what? Let's check that. I don't think I need that. And they, we don't need that. I was like, thank God and then I almost got the wrong MRI scan because I was leaning back in the thing, Jeff. And I'm like, I don't think this. And they ran back around. And they're like, oh, yeah, it's a different. And I'm like, thank God someone's paying attention here. You have to be your biggest advocate. So everyone, and I feel, has a story like this and understands this. Okay. Get a little bit more into exactly how this works, because you have on your website, providers, payers, patients. So is this digital care and so forth? Obviously you're checking your eligibility. So I'm assuming there's insurance that can cover it. Tell us more.
So how you come to Salvo Health is we have reached agreements with 801 GIs across the United States, which is about 16% of all the GIs in the United States, to deploy Salvo in their offices as an extension of their team. So you get Salvo from your local gastrologist or hepatologist, as part of seeing them. But what happens is that if, we are asking the patients, like you just said, you were your own advocate in that
Yeah.
instance. So what the best physicians in the world do with people with chronic conditions is they realize every person's different. Every person's journey is a little different. And you have to ask the patient to listen to their body and experiment over all kinds of evidence-based interventions to figure out what works for them. And we believe that you deserve a team if you're living with a chronic condition, whether it's obesity or MASH MASL, which used to be called fatty liver disease. Now we call it steatotic liver. And or it's IBS, or it's IBD, or it's celiac, or it's GERD. You deserve a team, but virtually. You're not going to go into the doctor's office every day. And so really health is about if you see someone at the doctor's office twice a year for 10 minutes, that's not where health is determined. It's the other 363 days a year in your daily life where health is created. And so what we create is a virtual team that is real people. You get to meet your dietitian, sometimes your GI psychology therapist, and your nurse always. And you're going to work with that team for the next 9 months to get to be the best you. And that is all science-based. And, you'll meet with your team monthly, but more importantly, you have the Salvo app, and it guides you every day. And you have the team always with you. And so your care plan evolves through food as medicine, microbiome, sleep, exercise, stress, it's all connected, environmental health as well. And we figure out what the solution is for you. And because we can afford to spend the time, it's covered by insurance, we spend over an hour with each patient over the course of a month. And we catch things that the doctors just don't have time to catch because they're under so much pressure. And, a typical thing we might catch might be something like, I notice every time you're eating avocados, you spend hours in bed in pain. Maybe you
don't
have
eat the avocado.
Well, that's part of it, but it might be that you have a pancreatic enzyme insufficiency. And in which case, our team might ask the physician to order a test. And if so, for a really inexpensive pill, your life has changed. Now you can have olive oil and avocados and fats and not spend hours in pain every day. And we just unlocked it, and it's really low cost. But it's the kind of thing where you need very trained people, and you need the time to work with each patient to figure out what unlocks them. My daughter has IBS, and she went through the Salvo program, and it's been life-changing for her. She used to spend hours in pain. She ate the wrong thing. She figured out what exactly were her food triggers, and now she avoids them. She's fine. So, people need access to this kind of trained professionals. I mean, even the physicians don't have training in nutrition, right? They get like a week at best in medical school, and they don't have time. So the beauty is for the physician practice, they are under such pressure to do the colonoscopies and endoscopies to rule out cancer, and that's absolutely the gold standard. But then they don't have time for the follow-on care after the diagnosis, and so we make it a profitable service for them. We do fantastic care. We save the doctors a ton of time, and we have published 5 medical abstracts on incredible health outcomes for the patient. So it's sort of one of these rare win-win-wins.
Well, that must feel good, Jeff. Gosh. Let me ask you, that was great, and we took a while to get there, but wonderful in the answer and so needed because you do need a team, you do need to be your own advocate, and doctors are slammed. And they're usually doing the triage of like, are you bleeding? Are you dead? Or we have cancer. Like that's what we're focused on. Totally get it. So stepping into a little bit more of you as an executive and CEO, now being 4 times around here to this one, what are you doing differently in this company than you have in the previous ones?
I think also, when I was 29 as a first-time founder, we all, we were all single, and the whole company, we'd work till, midnight, 7 days a week and all that. And I think as you become a more seasoned entrepreneur, and now I have a family, wife and kids,
a couple other things going on.
you try to be great at what you're doing, but more efficiently, and respect balance, I think, for people, and you realize it's a marathon. And so we really, have these core values, and one of them is that we are about the
I saw
whole
that on your
person
website,
for
yeah.
our patients. We need to be about the whole person for all the
Mhm.
employees as well, and really honor, what brings out the best in them, and that's probably not working 7 days a week till
Yeah, you're not
midnight.
on the 996
So,
schedule, it
that
sounds
I
like.
think
Right.
especially because we've learned so much about how important sleep is to health and productivity and things like that, and eating well, and moments of de-stress and all that. So I think we're all a little wiser and more efficient at cutting to like what's really the priority, what's really essential in building a company than I was at age 29.
Good. You said the whole person, and one of the other podcasts that we're actually doing is like people at work. How do you hire people? How do you get the best humans? We do a lot of stuff at BAM, and like humaning is so hard. Like, so some things we're doing are like hard things to think about. How do you trust yourself, for
Yeah.
example? How do you trust other people? We're on this whole voyage with trust right now. So when you reference the whole person, what does that mean to you?
Yeah. Well, I think for Salvo, it means elevating that mental health and your whole person, whether it's stress or sleep or exercise or your microbiome and health and all of that it's all connected. And so one of the things one of my favorite doctors said is that like in GI medicine, people pretend like, oh, there's the mental health talk therapist over there, and then there's the digestive tract. And so you need different doctors and it's different approaches and they have nothing to do with each other. And he said, it's like everyone forgets that your head and your body are connected. It's
Wild.
all one system,
Yes.
and so, it's that kind of, so the whole person health is, what is your biopsychosocial health? Do you have friends? Do you have, do you relax?
Yes.
Do you eat vegetables? Do
You eat
you,
vegetables.
we teach people sensory breathing.
But no,
Well, that's pretty
seriously.
important in gut health.
Oh,
Yeah. Fermented foods, even, we believe in food as medicine. And this stuff isn't, just traditional wisdom. It is science
yeah, how
backed,
about that?
right? So, we have 400 peer-reviewed interventions that are proven to help people, and then finding the right 8 that are really going to be right for
Yeah.
Beck, or a different 8 for John. That's kind of the magic, and it takes time. So that's what whole person health means to us. It's respecting the complex. What really gets me, and your listeners may be on TikTok and they may be on Instagram, and they'll see we have this value that says respect the complex. That's
Act
part
on
of whole person
respect the complex.
health.
Yes. So
Yeah. So, what that means, and it's tied to whole person health. Yeah. You're ever scrolling, Instagram, and someone will say, all you need for gut
this
health
vitamin.
is Akkermansia. This one species
Yes.
out of the 2000, Akkermansia, you just need Akkermansia and life is great. Or you just need a low FODMAP snack bar.
That's it.
That's if you have our low FODMAP snack bar,
You're good.
your IBS girls are hot,
Oh, God.
and all that. And it's all this marketing. And you realize, what works for one person doesn't work for someone else. And if you take a probiotic and you wash it down with a Diet Coke and a Big Mac, you've destroyed it anyway.
Yeah, how about that?
So there's no value in that. So you really need to look at someone holistically and help them.
That's
education. So
what I'm excited for, Jeff, is the frontier of the body. Forget space for a second. How about the internal? Also the deep ocean, but that's a whole other thing. But the all complete integration, and the future is You wake up every day, it does a scan. It's like, oh, Jeff, we noticed that this thing is off here, this thing in your gut, this thing in your pee, this whatever. Like, oh, and it's
Right.
so interconnected. And I think this is one of the things we'll look back and laugh at. Like, remember when you had doctors, they were all over the place and they were just, they didn't talk to each other. There was a chart, there was like, it'll be ludicrous, in my opinion. That's my hot take on
Yeah.
that medical health
Yeah.
was so disjointed, it was ludicrous. I mean,
We're so at the beginning of
so at the
understanding how
beginning.
the human body works. And there are
Yes.
more, and the key in gut health is there's actually more, cells in your body that aren't human than there are, humans. So like we've evolved to be symbiotic with all the organisms on our skin, in our gut, different parts of the body, in the mouth, and the oral microbiome and the gut microbiome and the skin microbiome. These things are so critical in producing the way we digest, the way our mental health and calm works. People, 75%, this is a real number of our patients with IBS also test clinically for anxiety or depression. And once you understand the science, you got to understand 90% of your serotonin and 50% of your dopamine are made in the gut, in this interaction between the epithelial cells and the microbiome. What does that mean for you? What it means is if your gut is messed up, there's a good chance you're going to be anxious and depressed, because if you don't have the right amount of serotonin, you can't be happy no matter how much talk therapy you do, because it's biochemical, right? So I think
by the way, that
you
is just
said, Beck,
hitting me in a way, because thankfully I have a good gut, all good. But I'm thinking of two people in particular who have stomach problems and who are ratchet in the mind, like just unwell. And I'm going, oh, aha, check the gut. Wow, I didn't know that connection, but it all makes sense, of course. Wow.
Science has come a long way, but we're still in the first innings. I agree with you.
So novel. It's barbaric in some ways, wow. Well, Jeff, let's ask like one little ending question here.
Yeah.
What recently became clear?
For us, one thing that I'll bring up is that you talk a lot about storytelling and learning lessons. And when we started Salvo, we had it wrong. We thought, oh, we don't need the existing system. Maybe we can just go direct to consumers and we'll just have a virtual doctor's office. I mean, we always kind of knew we would have to work with the system, but then we realized how wrong that was. And in fact, the physicians are so trusted and they have such an important value, but they are overwhelmed and busy. And so rather than building innovation that bypasses that trust and that value, why don't we innovate with the large incumbents and help solve their problems? And so that really was the journey for Salvo. Is a lot of the thinking among the VC community in digital health 1.0 just a couple of years ago was, we don't need doctors. We'll just go D2C. We'll just bypass everything. Need insurance. And it's not good medicine, first of all. And secondly, it's sort of throwing away a huge asset we talk a lot about in an AI world, what matters, what is branding, what is differentiation, what is lasting in an AI world. And I deeply believe that trust and brand actually will matter more, not less, in an AI world, because everyone will have access to the same LLMs. And so what matters is trust. And, in a world in our country where I got to tell you, people don't trust a lot of institutions anymore. And they often don't necessarily trust their health insurance company, but they still trust their doctor who they've met and known in person for years. That's very high. And so when their doctor says, I want you to be my patient, I'm going to help you with this diagnosis, and and I've got this
Yeah.
team
That's
from
gonna help
Salvo
you.
Health that's
Yeah.
gonna be your team, and they work with me,
Yeah.
and I want you to
Yeah.
do this. Patients enroll because that is a really trusted relationship, and then they love it, and 91% say this is better care, and they feel supported in a way they haven't. So I think we've learned that kind of the arrogant Silicon Valley innovation approach of like, let's just start with a blank slate of paper and we'll just fix it direct to consumer. That can work in niches, but that's not how healthcare gets transformed in America. We have to get into the big incumbents, and we have to help bring them into sort of the digital era. And that's kind of what we've evolved to learn.
Also, way to tap on the trust element, because what a time to be in storytelling, I like to say, because what do you trust? How do I know this video is actually real? How do I know I'm actually talking to you, Jeff? I really don't know. I could run this through AI or whatever. But like, how do you know?
Yeah.
And what a time to be in trust building or leveraging and using that. So I'm glad you unlocked that. That's very true. Wow. Jeff, it was great having you on today, talking about the gut, talking about all the connections to it, the future of healthcare. Just imagine. Oh my God. Jeff Glueck, founder and CEO of Salvo Health. Thank you for being here today.
Thanks, and I'm glad we got to share some coffee and some stories.
Coffee. It was my like vitamin drink, but yes, that was still fun. Thanks, Jeff.